Welcome to Unbiased Science.
Where we bring scientific method to the madness.
We're your hosts, Dr. Jess Steier
and Dr. Sarah Scheinman.
And today we are joined by such a special guest to talk about such an important topic, hormonal birth control, because we get a million questions about this all the time. And we have the amazing Dr. Bayo Curry-Winchell, who told us her nickname is Spicy Donut, and maybe we can explain why in just a little bit. But she's here to break down this important topic. Before we do, I'll give you just a 1-minute recap of something that we're looking at in public health news. So the AAP, the American Academy of Pediatrics, issued a statement today, which is really important. Basically, they raised the alarm that millions of children on Medicaid and those who typically receive vaccines through the Vaccines for Children program, the VFC program, cannot currently access COVID-19 vaccines because the ACIP meeting that happened a couple of weeks ago, that's the CDC's Advisory Committee on Immunization Practices. If you remember, they had their vote, but the CDC has to formally sign off on it, and then that impacts coverage and access. So this is a really big deal. Children from low-income families already face huge barriers to healthcare, transportation issues, parents who can't miss work for appointments, and so on and so forth. So this is just yet another barrier. So the AAP is urging pediatricians and parents to contact their members of Congress to demand approval of COVID vaccines distributions through VFC. I'll share a little bit more about this on Unbiased Science Stories. With that, I'm going to turn it over to Dr. Scheinman to introduce today's amazing guest, and let's get into it.
All right, guys, we are in for a treat today. We're going to hear from Dr. Bayo Curry-Winchell. She is a board-certified family physician, the medical director of urgent care clinics at St. Mary's Health Network in Reno, Nevada, and a passionate patient advocate. Known as Dr. Bayo on social media, she reaches millions through Instagram, TikTok, and her podcast, Beyond Clinical Walls, where she helps families understand their bodies and the healthcare system so they can better advocate for the care they deserve. A frequent guest on ABC and NBC, she serves on Nevada's Patient Protection Commission and previously served on the CDC's National Community and Public Engagement Work Group. Her TEDx talk on the Black maternal health crisis, Do No Harm, has over 2 million views and showcases her commitment to addressing women's health disparities and patient advocacy. You guys, I listened to that this morning when I was getting ready for work, and oh my God, I almost started crying. It was extremely powerful. Everyone needs to watch it, and we will link it in our show notes. Anyway, drawing from her own journey of misdiagnosis as well as her near-death experience during childbirth, Dr. Bayo brings both expertise and empathy as she empowers patients to take charge of their health. Dr. Bayo, welcome. We are so happy to have you on Unbiased.
Thank you both for just having me. It is a pleasure to be here.
Okay, well, because I had to say spicy donut, can you just in 10 seconds, what is that about?
Yes, I can. So my last name, which is incredibly long, and that's on purpose. So Curry is my maiden name. And I always like to share. So my father, I wanted him, I'm an only child. I wanted him to hear my last name when I walked across the stage because I wanted him to hear his name. And so I decided to keep Curry, and my married name is Winchell. And so it's quite long, Dr. Curry-Winchell. But my patients have given me this nickname because it can be hard to kind of digest. Curry like the spice, Winchell. A lot of people may have heard of the donut company. So they call me at the county that I work at, Dr. Spicy Donut. And I'm a little spicy. I'm definitely living joy all day long. And so I'm a blend, and it's awesome. So Spicy Donut.
I love that, and I figured our listeners would too. So thank you for sharing that. And just really quick aside, I'm an only child too, and so Steier is my maiden name, and similarly when I got my doctorate, it was very important for me that my father, who was very sick at the time, see me become Dr. Steier, and so that was super, super important to me, so I totally get what you're saying.
Oh, I love that. It is. It's one of those moments. I've been a Curry my whole life, and I'm still a Curry.
Exactly.
So I'm going to honor it.
Love it. My husband doesn't, well, that's a separate conversation. We'll talk about that another time. But anyway, so we kick off every episode with the same question, which is, what is a news item that caught your attention and why should people care about it?
So a news item is this thought process that Tylenol, I just have to go there. I can't not say it, isn't safe in pregnancy. And this conversation is one that I never thought we would even be talking about. It is a proven safe medication. And when you look at the limitations and the restrictions that are available for pregnant women to help with pain, to help with a fever, all of the things that we know as doctors that can be really detrimental to the mom and baby, never thought that I would see this. So that's the topic that I'm trying to advocate and share accurate information about.
Well, we should talk because this is something that we've been writing a lot about. We have a lot more content planned.
And
we are
for
getting
our listeners, last week's episode, we actually dove pretty deep into that, especially the connection between, or lack thereof, between Tylenol and autism. So if you want to tune into that episode to learn a little bit more about that.
By the way, that is Sarah's very nice way of saying, Jessica, shut up. We've already talked about this. No. But you know what? It's a nice bridge to the topic today because like the Tylenol issue, we've been inundated with questions about that. We're similarly inundated with questions from people who are concerned about hormonal birth control because there's a lot of, I'll say, information. Some of it is misinformation and disinformation about hormonal birth control causing things like cancer and infertility, and there's a lot of concern out there. So we're hoping that you can help us, separate fact from fiction. And so can we start, Dr. Bayo, can you tell us, how does one know if birth control is right for them or if it's safe for them to take?
So there's a lot out there. I mean, when you scroll through any social media, birth control is kind of at the forefront in respect to a lot of misinformation. And so I like to kind of break it down. Birth control has estrogen, progesterone. There are also types that do not have hormones. And then there's other modalities that are out there that are being shared on social media. And when it comes to choosing the right birth control for you, the first thing I suggest to my patients is first, let's take an inventory of what is important to you. Because there's pills, there's different insertions, there's different types. And so I lean into family history. Do you have a history of any clots? Do you have any history of any sort of thing that would prevent you from being on that birth control? Also, lifestyle. What is important to you? Do you want something short term, long term? Do you want children? Do you not want children? All of those things are an important piece to start with. And then, of course, the biggest thing is having a conversation with your doctor, because there are things that are not shared out there about birth control. And that's why I'm so excited that we're going to talk today to help people really have that individual, unique choice.
Well, what I was also just going to ask if you could maybe just for our listeners kind of go through in general the different classes. You alluded to it a little bit, but the different types of birth control, because there's so much out there. And we get a lot of questions on hormonal birth control, but you alluded to the fact that there are different insertions as well. So can you just kind of broadly talk us through some of the different types?
Yes. So I like to start with estrogen and progesterone. Often the birth controls that are out there, as you mentioned, are hormonal, and there's this combination or separate. Now there's also non-hormonal, like the copper IUD, which is a great choice for a lot of people who do not want to have hormones. And so that copper IUD can be placed and stay for about 10 years. The other form of birth control that we're going to talk about as well is this natural planning or cyclic, where you're watching your own cycle. And that is actually a big conversation online. So those are the big ones that we hear about. So the hormonal, which is often estrogen, progesterone, or maybe even progesterone by itself. Then we also have the non-hormonal, like copper IUD. And then we also have this natural planning. Online, you often hear it Cyclical or fertility method tracking.
So let's maybe, before we get into the deep dives on the hormonal birth control, let's maybe start with were you calling it natural family planning, that cyclical. I've seen a lot about this. People who tend to be very, I'm using air quotes, I don't know, like natural minded, right? And I'll hear things like, oh, you don't want to take something, you don't want to mess with your hormones, things like that. Can you talk us through maybe, I don't know, pros and cons of that approach?
This part is important because I like to share that one size doesn't fit all. And when you scroll through social media and you're seeing all of these different stories, which stories are important to hear, but that doesn't mean that story is the right fit for you. And I think that's important when you're choosing which type of birth control or what type you would like to actually choose for yourself. And so when we look at the different types, whether it's hormonal or non-hormonal or the natural planning is focused on everyone having a period of a 28-day cycle. And so normally you have to have ovulation to release an egg, and then we have the sperm, and then we have a baby. Well, not all of us have a traditional cycle. I'm sure everybody listening right now has probably had maybe a 5-day, maybe you didn't even get a period. All of these things can impact how your period works. So with the fertility method or natural tracking, in order to optimize it, you would have to have what they call a traditional or typical cycle of that 28 days. You need to track if your temperature is up. So there's different things like if your progesterone goes up, your temperature goes up, that can change if you are more likely to get pregnant. And so that label of natural also comes with consistency, timing. There's a lot of things that have to play into it. And unfortunately online, there is this thought that this is like the best option. And for me, as a family medicine doctor, I lean into individual because you can't just say this is going to be the best. Yes, there are side effects and benefits to both on both sides, but every person is different.
Yeah, I mean, I think there's this whole idea of like personalized medicine. Like it sounds like that's kind of what you're alluding to. Is that right?
I am. We are all unique. We all have different things that work maybe a little bit differently. And so when it comes to hormones, progesterone, estrogen, or our family history, any history of cancer, high blood pressure, diabetes, having one method, whether it's the fertility natural planning or hormonal or non-hormonal, it's important to have a conversation with your doctor. But before you even do that, because I think there's power in knowledge. And so if you can take the information we're sharing today and say, okay, do I have any family history of blood clots? Do I have any family history of cancer, of migraines? Because that also can change, should you be on a hormonal or a non-hormonal type of birth control? And then those lifestyle factors as well. So starting with those top two things where you write it down, I call it your own health playbook. You're going to write those things down. What is important to you? What is your family history? And that way, when you see your doctor, you have this lovely playbook of the questions, the concerns, and also what you would like. That really helps kind of get the conversation in the direction that is individualized to you.
Okay, so sorry if TMI, I have my period right now. It is day 3, but it's giving day 1. And it's one of those, not ideal. And I have some friends who they'll take the hormonal birth control and they'll space it out or take it so that they're skipping their period, especially if they are going on vacation. Or I remember my friend on her wedding day, she wanted to skip the period, push the period out, whatever you want to say. So I'm wondering, what are your thoughts on that? Is that dangerous? Are there dangers to skipping your period indefinitely with birth control?
So the great thing, the data has shown that birth control, and of course everybody's different, is safe. There's great safety behind the use of birth control. And so when you alter it, as far as if you're skipping that period or you are kind of delaying your period, studies have shown that it does not increase your risk for any sort of abnormality or complication. And so again, that's why that lifestyle piece is important to you. And the other thing that is not in the conversation when you look online or sometimes with that misinformation, that birth control can be very helpful for those who are suffering with endometriosis, polycystic ovarian syndrome. And that conversation needs to be more talked about, because there's a saying that I often share. We are more than just reproductive health. Women are more than just our reproductive organs. And when you take note of that and you realize that these types of medications can be life-saving for people who have these types of conditions, that is what we need to talk about.
Absolutely. I'm so glad you mentioned that, because I feel like that's not something that is often thought of. When we think birth control, we think typically like preventing periods or family planning, stuff like this. But I think what a lot of people don't realize is that they are also medications that are used to treat certain conditions, and like conditions that don't really have any other proven medications that work for their treatment. Is that correct?
That is correct. I got excited when you said that. I'm going to share with you, I have still a 19-year-old patient who was really suffering with complications from endometriosis. And for those who don't know, endometriosis is a debilitating condition where you have the lining that is normally found in the uterus that sheds when you have your period. Well, with endometriosis, those areas, that lining that is normally housed in the uterus, can be found in the lungs. It can be found in all areas of the body. So imagine how you feel when you have a period and how painful that is. And that is happening with someone with endometriosis in their lungs. So they might have shortness of breath. It's happening in other areas. And so for her to be able to be on a birth control that helps mitigate and relieve those symptoms, that's life-saving.
Okay, so next question that we get a lot is about how hormonal birth control impacts fertility, especially in the long run. And let's say you're taking hormonal birth control, is there a certain period of time that you have to wait, or that you would have trouble conceiving, things like that. So what's the scoop on that?
So there's a lot of talk about, birth control ruined my fertility. And when I hear those terms, and I honor those terms because you always want to take in those stories, for me as a scientist, then I like to kind of dig and say, well, we do know that every person's cycle, like we talked about, everybody's health factors are different. And when you take in that piece, it's interesting because before you took that birth control, was your fertility already compromised? And those are the parts of the narrative that aren't talked about. So you could take a birth control pill and then all of a sudden get off and have a hard time conceiving. But that could have happened even if you weren't on birth control. And the beauty of all of that I shared is it comes with receipts. It comes with data that supports that those who have been on birth control and those who haven't, the fertility rates are very similar as far as being able to conceive. So that's how I like to compartmentalize when I hear those stories. And then, because I do believe in how can I support someone who's sharing that story? And so that's when I ask them, I say, do you have any history of trying to conceive before you were on the birth control? Do you have that kind of 6 months, 12-month time frame? And often they don't. And so that helps reshape their perspective on what could have been the reason why their fertility challenges are happening.
Yeah, it sounds like there's no way of knowing for a lot of patients whether or not it was the birth control that are causing fertility issues. I mean, it sounds like it's like the definition of a confounding variable here.
That is correct. And to your point, when we talk about confounding variables, let's not forget the different health conditions. We talked about polycystic ovarian syndrome, endometriosis. There are a lot of conditions that can also reduce your risk of being able to conceive. And let's just go back to being women. Women in healthcare are more likely to have a delayed diagnosis. Endometriosis, 7 to 10 years to get a diagnosis. So when you compound all of those factors together, we are already at a disadvantage of conceiving or knowing about our diagnosis, getting treated. So to focus on one thing as the issue instead of looking at the entire picture of all the disparities, all of the lack of information we have when it comes to just our general health. And I'm going to add one more thing to that. As far as women's health, we have not been studied at all, really. And I like to correlate it with Netflix. Netflix has been around for about 30 years. That's the same amount of time that we've been studying women's health. So there is so much that we do not know about how our bodies work, how we process medications, what diseases are more prominent. So to blame it on one thing is a miss. Instead, let's focus on what other information we need.
That was so beautifully said. And also that Netflix analogy is jarring. Right? Like mind just blown.
That really puts it in perspective.
It does. Oh my gosh. The other big thing we hear about is cancer risk. Can you comment on that and whether hormonal birth control increases the risk of certain cancers?
So there's a lot of things trending, and cancer has been, kind of the focal point. And the data shows that those who are on birth control actually less likely to get cancer. And so they followed a group of women along, and the percentage was remarkable. I believe, and I'm trying to make sure I have that percentage, and I'll add that data, that research, but it has been shown to reduce your risk of ovarian cancer. And I like to always give a definition of how ovarian cancer impacts women. It is one of the cancers that is very difficult to diagnose. Why? Because of the symptoms. Early satiety, meaning you get full quickly. Bloating. I think every woman listening to this has experienced bloating. Constipation. Fatigue. Right, I can raise my hand. All of these things. And all of these symptoms can also be associated with, oh my goodness, your period, just life, what you ate that day. And so that really makes it challenging to diagnose ovarian cancer. And because of that, we often are not able to diagnose it till later stages in life. And when it comes to cancer, earlier is better as far as options. And so I'll go back to the fact that the birth control pills have been shown to reduce your risk. That's huge. That's a huge piece. And the other thing I want to highlight is when we talk about breast cancer, ovarian cancer, endometriosis, all of the conditions we mentioned, if we can get a jump start on reducing the risk of those cancers, the longevity that we get not only for ourselves but our loved ones or whatever we would like to do, that's huge. And I like to give that as an example.
Yeah, that's so helpful. And I'll link to this in our show notes. We actually did, we've done a few posts on this, but we did one post that sort of goes through a bunch of different myths or concerns about hormonal birth control. And one of them was about cancer. And if it's okay, I'll just read it. It's super brief. It just is, for starters, cancer, like you said, is multifactorial, meaning that many factors can influence cancer risk, including genetics, environment, and lifestyle choices. While hormonal birth control may slightly increase the risk of some cancers, like breast and cervical cancer, again, totally depending on family history and all these other factors, it can actually decrease the risk of others, like ovarian ovarian, endometrial, and colorectal cancers. So overall risk of cancer actually decreases. And so for most, the benefits far outweigh any minor risks, and overall cancer risk is typically decreased by hormonal birth control. So yeah, thank you for that. It's one of those things that's nuanced, right? And so I think, this is something that we get lots of questions about all the time. Sorry, Sarah.
I was going to say, and we were just talking about endometriosis, right? And how birth control is often used as a treatment for endometriosis. And it's my understanding that endometriosis is a risk factor for certain types of cancer itself. So by treating your endometriosis, then you're in turn perhaps decreasing your risk of cancer.
That is correct, and that speaks to me because as a family medicine doctor, I get to see all ages, and I also see a wide variety of different conditions and diseases. And so I'll see, a patient with endometriosis, and she probably has diabetes, high blood pressure. We've got a lot going on. And so that overall reduction, that ability to reduce her risk factors for other diseases are important. And I'm so glad that you read, the data points show that it does reduce. Now, there's a lot of things we don't know, but that's where we need to fill in with research and including women of color, different modalities that we know can impact your increased risk or can increase your risk for cancer. That's where I think the power, the funding, the research needs to go into. And the misinformation that's out there, yes, let's have a conversation, but reminding ourselves that these are people's lives. The choices that are being shared that are rooted in misinformation could impact that person in that moment.
So one more question for you, and then Sarah, I don't know if you have any others, but so I remember I've tried a couple of different types of birth control in the course of my life. I took pills, hormonal birth control, and then I switched to NuvaRing at one point, and that in particular really wasn't for me. It caused some other issues, some localized pain and some other stuff, and it caused me to stop that. So this is a long way of saying that there are some reasons why, certain types of birth control are not going to be for everyone, right? And so, how can people advocate for themselves if they are having birth control side effects? Because I think overall we're saying that it's, personal choice. Overall, it's safe. We have amazing data on it. We, debunked some concerns around infertility and cancer. But even with that, it still might not be for everyone. So how can people advocate for themselves?
The first thing is to write down or even voice and record. I actually recommend that about what you are experiencing when you start that birth control pill. And, am I feeling more nauseous? Am I getting more headaches? Do I feel like I'm bloated or gaining weight? Once you have what you're experiencing, I ask everybody to write down, how often is it happening? Is it happening in the morning? Is it happening at night? Is it happening 2 to 3 times? I want you to label it. The other thing is, have you noticed that it's getting worse? Or is it staying the same? Leaning with those things and memorializing it, writing it down, and then before you even see your doctor, practice saying, I've been on this pill for a month and I've noticed that I feel more bloated all throughout the day and it's getting worse, and having that time frame. It's what I call my clear, concise, and confident, because when you go in and you talk to your doctor and you want to advocate for yourself and you're like, this pill is not working for me, I need you to do something now. The best thing you can do is to have all of that information in a way that your doctor can process, because your doctor wants to help you, but I know as a doctor, when I'm listening, if I can hear it in a way that I know I write and I learn information, or how I learned in medical school, it helps that conversation be even more fruitful, and it can help you be heard. And when you're heard, that's how you move forward to advocating for yourself. So focusing on how it made you feel, what symptoms you have and being confident in it. So I call it being clear, concise, and confident. It's called my 3 C's. And so then going in, and then if your doctor doesn't listen to you and doesn't believe you, because I like to give a second step because it doesn't always work, I lean with, help me understand why you think I need to still be on this medication. That way it's not confrontational. I would like to know why you feel, because sometimes there might be where that doctor may say, I think you should give it 1 more month. I really feel like in a month those symptoms may go away. Or they may have to take a self-check and say, maybe I didn't hear her well. Why should you be still on that? And so when you can come together in a way that doesn't make you feel as a patient, because not everybody feels comfortable, confronting. And I want to honor, there is a power shift that happens from a patient to a doctor. It does not matter your education or your finances. There is something all of us have experienced. You go into the doctor, you have all of these things that you want to say, and all of a sudden it vanishes. Why? Because there's just a different shift in that power. And so if you can come in armed with that information, write it down, put it on your phone, and then share it in a way that, honors your feelings, your thoughts, I think that is a very underutilized way to advocate for yourself, especially when you're having symptoms that are not serving you.
Love it. Love it so much. That's so powerful. Thanks for that advice. Sarah, do you want to ask our wrap-up question?
I do. So, Dr. Bayo, we like to end things on our episodes this season just because there's so much going on in the world with a little bit of hope. So we'd like to ask you, what is something that's giving you hope in public health and science in the world right now?
The movement of advocacy that you can see from the societies, whether it's the Pediatric Society, the Family Medicine, everybody coming together, coalescing to make sure that the science is there to combat the misinformation that continues to pop up. And that has been really inspiring to me, to see us all come together and say, no, this isn't true. And then to share how this impacts our patients, how it impacts public health. All of those factors gives me hope. And I also have to say, another part that has just given me hope is a thing that I just recently created, and I'm really proud of it because I know that it is bridging the gap. And I launched 3 weeks ago. It is a free crowdsourced patient recommended list called Clinicians Who Care. All of us have experience. I always like to say, raise your hand if you've ever been dismissed when you've gone to the doctor. And the stories are there. And I recently shared what happened to me when I was in college, where I had to go through multiple doctors to get a diagnosis of lupus. And when I shared it, the stories poured in, community was created. And in that, I thought, how can I bridge patients and doctors in a way where you can focus on finding a doctor that listens, cares, and believes you? So I created a Google Doc. It's a free list. And the only factor is share how this doctor made a difference in your life, because you can have the most access in the world. You can have all this information. But if your doctor doesn't believe you, how are you supposed to access it? So it's like a list, like you think Yelp for restaurants, but it's a list for patients. And people just share the entry of the name of the doctor, the city, the state, and now the country, because now we have almost 1,500 names worldwide. And you write in free text why that doctor made a difference. So imagine that woman, or because this list is for everyone, but imagine that person thinking, I have a child, or I'm struggling to find a doctor that will take me serious and that will believe me. You go to this list, Clinicians Who Care, you can organize it, see the name of possibly in your city, and it connects you. So
it's amazing. Oh my gosh, Dr. Bayo, your passion is contagious. Your compassion absolutely pours out of you. We are going to drop links to all of everything that you mentioned. You have a website, drbio.com. That's DOCTOR, and then bio is BAYO.com. You can also follow Dr. Bayo on social media. She's on TikTok and Instagram. Same thing, right? Dr.Bayo.
Yes.
We'll link to all of this. What an absolute pleasure and honor to have you on the pod. Thank you so very much.
Yeah.
Well, I would like to extend a level of gratitude to you, but to both of you for this beautiful conversation that elevates and uplifts science. And you guys are doing a fantastic job. Well done.
We love you.
Yes,
We love you too.
As per usual. All right, Sarah, before I cry, take us home.
Okay, thank you all for tuning in. We hope you learned a thing or two. I certainly did. Please join us next week on your trusted source for no nonsense, just science.